Hi, this is Stephanie Bolton with Healing Sounds Music Therapy, and today I wanted to make this video and talk to you a little bit about the signs and symptoms of suicide. So according to the Centers for Disease Control, suicide is the leading cause of death in the United States, and depression affects 20 to 25% of Americans over the age of 18 every year. That's 1 out of 4 people. But only half of those experiencing depression get the treatment they need for it. However, 80 to 90% of the people who do look for treatment and get it are successfully treated with either medication, therapy, or a combination of the two. So it's important to know that suicide is preventable, and that starts with knowing what to do and what to look for. So a little public service announcement here: if you or someone you know is thinking about suicide or talking about it, then it's important that you call the National Suicide Prevention Hotline at 1-800-273-TALK. That's 1-800-273-8255. It's open 24 hours a day, 7 days a week, even on holidays. And you can talk to a trained counselor if you call that number. If you're located here in the Huntsville, Alabama, Madison County area, you can call Crisis Services at 256-716-1000, and they'll also be able to help you and direct you to treatment options that are available here in this area. So some of the signs and symptoms of suicide. Many people don't know that people who commit suicide don't necessarily want to die, but they just want to end their pain. They're in such pain that they just can't see how they can handle it or get past that. So don't dismiss their talk as just a meaningless threat. If you notice any signs of that, then you need to get help for them. Some people talk about death. They're focused on death. They talk about wanting to die or to commit suicide, or they dwell on that topic. They might be researching ways to kill themselves or how to buy a gun, things like of that nature. Sometimes they make plans. So they may take some steps to start to prepare for their suicide. For instance, they might update their will. They might start giving away some of their personal belongings. They might start writing letters saying goodbye to people nearest to them. They also become more withdrawn. They start avoiding their close family and friends. They stop attending maybe some events or social activities that they used to enjoy going to and being part of, and they start isolating themselves. So you might notice that, if you reach out and offer to take them to dinner or have lunch or go to a movie together, that more and more often they're turning you down on those invitations. Someone considering suicide or being extremely depressed will have swings in their mood or their sleep patterns. So they might be increasingly anxious, sad, angry, irritable, or moody. And once they've sort of decided that they want to end their life and commit suicide, then they'll become calmer because they've made that decision and they feel at peace with it. Other risk factors for suicide can include other mental health disorders or problems, if they also have an addiction to alcohol or drugs, if there's a serious physical illness, if they've recently gotten a terminal diagnosis or a chronic diagnosis for some medical problem, then that could contribute to them considering suicide. If there's been a major loss recently, whether it's a family member or a job or a significant relationship, that can also increase their thoughts of ending their life. And if someone has a history of trauma or abuse, that also can contribute. So how can you help? If you know someone who's experiencing some of these things that I've mentioned, or they're starting to talk or mention committing suicide or thinking about death more often, you can take those things they say and what they do, you take that seriously and just let them know that you're there for them, that you care, that you want to help, and give them the phone numbers I mentioned earlier. Point them in the direction of a local therapist. Try and encourage them that they're not alone and that help is available for this situation. So if you have any other questions, please leave me a comment on this video. Reach out and contact me through my email, my website, my Facebook page. I'd be happy to answer more questions or give you more information or give you a referral. If you're in the Huntsville area and you don't think music therapy is for you, then I'd be happy to give you the name of another therapist who might be able to help. So I hope you found this useful, and thanks for watching.